All right, good afternoon, everyone, and welcome. Thank you for taking the time to join us for today's educational webinar hosted by PA Foot and Ankle Associates. Today's topic is neuropathy, understanding diabetic and non-diabetic nerve pain, and we're honored to have Dr. Adam Teichman with us as our presenter. Dr. Teichman is a respected podiatric physician with extensive experience diagnosing and treating peripheral neuropathy and its complications. In addition to caring for patients every day, he has traveled throughout the country educating both healthcare professionals and communities on diabetic and non-diabetic neuropathy, helping people understand the causes, symptoms, treatment options, and ways to improve quality of life. During today's presentation, Dr. Teichman will discuss the differences between diabetic and non-diabetic neuropathy, common warning signs, available treatment options, and practical strategies for managing nerve health. He will also introduce NeuroHealth, a nutritional supplement he helped develop in collaboration with Rescue, designed to support overall nerve health as part of a comprehensive treatment approach. We'll conclude this presentation with a live Q&A session, so we encourage you to write down any questions you may have throughout the webinar. Before we begin, please note the following disclaimer. This presentation is intended for general education purposes only. It does not replace an individual medical examination, diagnosis, or treatment plan. Medication and treatment decisions should be made in consultation with the patient's qualified healthcare professionals. With that, it is my pleasure to introduce Dr. Adam Teichman. Dr. Teichman, thank you for being with us today. We're excited to learn from your expertise. The floor is yours.
Thanks, Jared. That was a great intro. So today we're going to be talking about, diabetic and non-diabetic neuropathy, the causes and the treatment. Hopefully, after today's information session, you'll take some information and be able to make a educated decision on how you manage your neuropathy concerns, or someone that you know that has neuropathy. You can provide some helpful advice and direct them on how they can get in touch with someone to help with their neuropathy treatment plan. And some of you might also be currently in a treatment plan. Hopefully, you can understand some other options, whether it's holistic, whether it's through supplementation or through medicinal, to treat neuropathy symptoms. Like Jared said, I am a provider here at PA Foot and Ankle Associates, specializing in neuropathy treatment and management, whether it's diabetic or non-diabetic neuropathy. So to start out, we're just going to basically, I'm going to have a little presentation here so you guys can follow. And if you have any questions, feel free to ask them at the end. It will be time at the end of this presentation. It should last about 30 minutes during your lunch. And I appreciate you guys taking time during your lunch hour. Let's see if this is not going to work now. Let's see if it works. There we go. So we know that there's different types of neuropathy. There can be autonomic or peripheral sensory neuropathy. And just to review the nervous system, so we talk about neuropathy in the nervous system. We know that the autonomic nervous system is basically the system that's read from the central nervous system to the essential organs in the body, such as bodily functions, such as breathing, heartbeat, and digestive process. It's really the autonomic nervous system. And then looking at the peripheral nervous system, this is really what's transmission from basically the central nervous system, your brain, spinal cord, into the rest of your body. So talking about sensory and motor nerves. And really, when we talk about neuropathy, we really focus on the peripheral nervous system. And that's really the sensory system in the body, of how our body can sense heat, temperature changes, and things like that, that can almost protective sensation, we call it, when we're looking at things that can affect the sensory system in the body. So what is neuropathy? And really focusing on peripheral neuropathy. We talk about peripheral neuropathy. It's neuropathy. Understand that affects about 8% of people over 85. And the most common type of peripheral neuropathy is diabetic neuropathy. And we know that that is a common risk associated with diabetes. When the sugar gets out of control, or we have circulation issue, it can really affect the nerve endings, affecting the peripheral nervous system of the body. And it's estimated about 20 million people in the United States have some type of peripheral neuropathy. And like we said, the most common is type 2 diabetic neuropathy. And this is usually a result of damage to the peripheral nervous system. And what type of damage do we look at? We look at, mainly oxidative stress and inflammation is really the most common causes of peripheral neuropathy. And so what are some of the symptoms? A lot of people complain about, symptoms of peripheral neuropathy, where inability to feel pain or temperature. So we can say sometimes numbness or burning or tingling in the feet. And that's usually associated with people with diabetes. And that's contributed, as we know, to higher risk of amputation because of the fact that they can't sense or feel their extremities, especially the lower extremity. And that can lead to wounds that might not heal, or they might have a wound that they might not notice. And then we could look at sometimes we have motor nerve damage that could lead from muscle weakness. Also, people that have twitching or muscle atrophy, and that could be shrinking of the muscles and decrease in reflexes. That are some of the things that can affect peripheral motor neuropathy. And like we said, a lot of the sensation decrease, since that's felt mostly the hands and the feet. So people might feel like something called stocking glove distribution, might feel like they're wearing gloves or stockings on their feet when they're actually not. And that can lead to some type of numbness. They can lose position sense and also make them feel unstable when they're walking. And also, hard to get through our daily activities such as fastening buttons or maintaining their balance. So these are things that go associated with peripheral neuropathy. And this sensation can affect the skin, or also basically, like we said, proprioception, where they feel like where they're in space. So, this sensory neuropathy can lead to changes in skin, the hair, as well as it can lead to joint and bone damage. So it's something that we should be really aware of. And from today's information session, hopefully you can understand some of these symptoms and relate them to maybe something that you have or someone else you has, and you can help them address some of their concerns, or at least point them in the right direction of how they can somehow get this managed or treated. So the causes of neuropathy, there's many different causes of neuropathy. I think we mentioned one of them, which is diabetes, and that's kind of the most common, which is a metabolic disorder. Usually affects 60 to 7% of those people with diabetes. They can have mild to severe forms of nervous system damage that can affect the sensory, which we talked about, also the motor, and also the autonomic nerves. We talked about that, how it can affect sometimes the kidneys or the eyes as well, and present with various symptoms such as numbness, tingling, or burning. And then also, you can have physical injuries. Sometimes that can cause a neuropathy. That's an acquired nerve injury. So some type of physical injury can lead to nerve issues. And then also circulation issues can also lead to neuropathy. The small vessels that supply oxygen to these nerve endings can lead to nerve tissue damage. And diabetes is frequently related to small nerve vessel injury, leading to impaired blood flow to affect these nerve endings. And then lastly, also autoimmune diseases can also lead to neuropathy, such as things called Sjögren's, lupus, rheumatoid arthritis, are some of also these other things that are common associated with, peripheral neuropathy. So, if you're suffering from some type of numbness, tingling, or burning, it's really important to understand the etiology. So if you have some of these, whether it's autoimmune or metabolic or endocrine disorders, they can be contributing to the neuropathy symptoms. Also, toxicity from chemicals, chemotherapy-induced neuropathy is really common as well. So someone undergoing cancer treatment can actually have peripheral neuropathy. It's really estimated that about 30 to 40% of people who undergo chemotherapy develop some type of peripheral neuropathy. And it's really a leading reason why people with cancer stop chemotherapy early, is because of the neuropathy treatment. So it's number one, it's important to understand that the side effects of chemotherapy agents and treatments can lead to neuropathy, but also there are options to help alleviate some of those neuropathy symptoms while you're undergoing some of those chemotherapy treatments. So it's really important to understand that, you should really undergo these chemotherapy necessity treatments to treat your cancer, but also not stopping them, and understanding that there are treatment options to help alleviate some of the symptoms or treat them long term. Also, kidney disorders and infections can also cause peripheral neuropathy. And again, exposure to toxins. So if you're working around in a toxic environment with chemicals, that can also lead to neuropathy. I had a patient who was working in a funeral home and was embalming patients, and he developed peripheral neuropathy from the embalming ingredients that were used to embalm those patients. So be aware that if you are exposed to certain toxins, that can also lead to peripheral neuropathy. So this slide here is basically just showing you what can happen, especially when we talk about diabetes and diabetic neuropathy. Like, the leading cause of how this starts is when we get uncontrolled blood sugars. We know that If our blood sugars get out of control, that can lead to oxidative stress and chronic inflammation. And the complication of having higher levels of oxidative stress and chronic inflammation in the body, it can damage insulin receptors. It can affect how glucose transport in the body. It can affect, how basically insulin is secreted from the pancreas, and also can lead to damage to protein in the body. And that ultimately can lead to damage to basically increase oxidative stress and inflammation and lead to damage to endothelial cells, which then can lead to damage to nerve cell damage, kidney damage, and eye damage. It's kind of that pathway where uncontrolled blood sugars can have a negative effect on the body. And since we're talking about neuropathy today, how can it have a negative effect on the body is having higher levels of oxidative stress and chronic inflammation can lead to increase in blood sugars, which can lead to type 2 diabetes, which can lead to complications associated with neuropathy. So this chronic cycle of oxidative stress and inflammation are really the underlying causes of type 2 diabetic neuropathy and the complications that go along with it. And we know with oxidative stress, you can get increased free radicals that can damage insulin receptors and glucose transporter proteins, which ultimately lead to basically increased levels of free radicals, which can lead to this tissue damage. And then that leads to chronic inflammation. And we know that chronic inflammation can lead to basically damage to the nervous system, affect the kidneys, the eyes, the heart, the pancreas, and other vital organs because of the fact with chronic inflammation can lead to affecting circulation in the body and how things are transported from one part of the body to the other. Because when you get chronic inflammation, the vessels start to narrow, you can get atherosclerosis or plaque buildup, and all these things can lead to issues, including diabetic or non-diabetic neuropathy, because how those vessels feed the nerve endings can affect ultimately how those nerves function and can lead to neuropathy, which is a numbness, tingling, or burning in the extremities. So how does peripheral neuropathy diagnosed? So normally it's basically a conversation we have with patients and asking them what symptoms they have, if they have burning, tingling, numbness in their feet. That's kind of leads us down a path to say, all right, so if you have symptoms of neuropathy, how are we going to really diagnose this and understand what's going on in the etiology? So the first thing we can do is a nerve conduction study. This test measures the degree or damage of large nerve fibers, revealing whether symptoms are caused by damage to the myelin sheath or the axon, which is the transport communications between the nerve endings. And that myelin covering is responsible for how fast that conduction process goes from one nerve to the other. And that test actually stimulates a nerve fiber, and how it responds is really going to determine exactly how we can determine the frequency or basically the electronic impulse of how fast that transfer is made between one nerve to the other. And that can determine and let us understand if there's any type of conduction velocity decrease. And when that conduction velocity comes back abnormal, that can be a sign that there's something going on with the nerve, such as neuropathy. And we can actually determine the level of neuropathy or where it's coming from, because sometimes if you have neuropathy, it's really not due to diabetes or some type of idiopathic neuropathy. Sometimes it's coming from the back. Sometimes lower back issues can contribute to neuropathy. So an EMG or nerve conduction study is one way for us to understand exactly the etiology of the neuropathy symptoms and what's going on. And with the nerve conduction velocity study, we can also do an EMG that involves the fine needles putting into muscles, so we can get electronic recording of the muscle response to the abnormal electricity that's submitted during the test. And that can help us differentiate between muscle and nerve disorders, again, determining on the level. And we can also look at MRIs to determine exactly what's going on. If it's a lower extremity and coming from your back, it can rule out tumors, herniated discs, or any other abnormalities that might be causing neuropathy. And then also nerve biopsies. Epidermal nerve fiber biopsies are kind of the common way we go ahead and determine the underlying cause of lower extremity neuropathy. So what we do is we take a little pinch of skin, about a 3 millimeter punch of skin, about 10 centimeters above the lateral malleolus, and that can quantitatively let us look at how many epidermal nerve fibers in that area. And we can determine if it's decreased from severe to mild to determine the severity of neuropathy. And then over time, as we start treating neuropathy, we can repeat that nerve biopsy in about 6 to 12 months. And that can let us truly understand if it's improved or not by looking at the quantitatively the amount of epidermal nerve fibers in that area. And that's kind of how we usually go ahead and diagnose peripheral neuropathy in a patient who's suffering from some of those symptoms. And so, what are some of the treatments that we offer for diabetic or non-diabetic neuropathy? So, first, we have to address the underlying conditions. So, whether it's toxin exposure, medication related, vitamin deficiency, hormonal deficiency, all these type of deficiencies should be ruled out when we're talking about neuropathy and addressing the underlying cause. And also understand too, that peripheral nerves have the ability to regenerate axons. So basically, peripheral neuropathy has the ability to reverse itself as long as those cells have not died. And understanding that's important when we talk about treatments to actually figure out how we can regenerate those axons over time. And that's really where treatments come into play. You might have heard of supplementation with vitamins, including B12, B6, B9, alpha lipoic acid. All these supplementations have played a role in helping axons regenerate or restore to their normal working condition as well. So understanding that peripheral nerves have the ability to regenerate is really important when we talk about treatments for neuropathy, and also adopting healthy lifestyles, because we know that uncontrolled blood sugars can actually lead to, basically, like we said, oxidative stress and inflammation. So adopting a healthy lifestyle, such as maintaining optimal weight, avoiding toxins, exercising, eating a balanced diet, correcting your vitamin deficiencies, getting your blood sugar under control. All these things are important when we talk about how can we address the underlying causes of neuropathy, especially when we focus on type 2 diabetic neuropathy. And we know the negative effects that smoking can have in the body, but also smoking can actually have negative effects on nerves because it can cause blood vessel constriction. So stopping smoking is particularly important because of the fact that we know that blood vessels supply the important nutrients that we need to these peripheral nerve endings. And smoking can worsen neuropathy symptoms because of the constriction it can have on blood vessels. So smoking is something important. If you are a smoker and you have neuropathy, it's really important to understand that stopping smoking or cutting back and slowly progressing to a point where you're no longer smoking is important to address some of those concerns of the neuropathy symptoms. And also associated with type 2 diabetes, we know that smoking and type 2 diabetes have a negative impact on the body and overall have a negative impact on our overall health, which can increase our cardiovascular risk profile to the point where it can affect circulation as well. So it's really important, if you're a type 2 diabetic suffering from neuropathy and also smoking, to really reevaluate and choose some healthy lifestyle choices. And lastly, systemic diseases frequently require more complex treatments. So, strict control of blood glucose is important when we talk about type 2 diabetic neuropathy. We want to reduce neuropathy symptoms and help with diabetic neuropathy to avoid further damage. So, if you're a type 2 diabetic and have uncontrolled blood sugars, not only is it important to get the blood sugar under control, but we should also determine the underlying cause and look at how we can help reverse and regenerate some of those axons from the damage that occurred. And that's really where supplementation comes into play. So understand too that peripheral nerves have the ability to regenerate axons like we talked about. This is really important when we talk about treating diabetic neuropathy, because a lot of people who have diabetic or non-diabetic neuropathy think that this neuropathy might be with them forever, and there's no way that they can regain some of the sensation that they lost. Well, there is a possibility, an opportunity, because of the fact that we know that peripheral nerves have the ability to regenerate axons as long as they're not dead. And so we know that we can get a functional recovery over time by correcting the underlying condition or cause of neuropathy, such as whether it's type 2 diabetes, or if you're introduced to toxins, or if it's a circulation issue. Sometimes we can restore some of that circulation and address some of that inflammation, oxidative stress, to reverse that by looking at antioxidants, just as alpha lipoic acid, which is a great antioxidant to help combat some of the oxidative stress that can occur, which can reverse inflammation in the body as well. So it's really important to understand that we do have the ability to regenerate axons as long as the nerve cell itself has not died. And it's really important to understand that it's really not basically the end result. If you have neuropathy, there's no other options. There are definitely options out there to help restore some of the sensation and also reverse some of the neuropathy symptoms that people are suffering from. So how do we manage it? So we talk about medication and supplementation. So the common medications that are available to manage neuropathy, I'm sure people heard of the word gabapentin or Neurontin. That's probably the most common medication that's used to treat neuropathy. And there's also something called Cymbalta. There's also something called, I just forgot the name of the other medication. that's used to treat pregabalin is the other medication that's used to treat neuropathy. Those three medications are the most common neuropathy management medications. And believe it or not, that gabapentin is the most commonly prescribed medication out there for neuropathy, but it's not FDA approved to treat neuropathy. There's really only two or three FDA medications used to approve to treat neuropathy. That's pregabalin and Cymbalta are the top two that are used to treat diabetic and non-diabetic neuropathy that are FDA recommended. But pregabalin, even though it's the most common, or Neurontin is the most common medication to use, the FDA does not recognize it as a management for neuropathy, even though it is successful. And depending on the dose, with example for gabapentin or Neurontin, you might be on a low dose of 100 milligrams at night or up to 1,800 milligrams a day. And we know that with medications come side effects. A lot of side effects come with medications to treat neuropathy as well. And then supplementation, which we'll talk about too, is looking at the benefits of B6, B9, B12, and alpha lipoic acid in addressing neuropathy symptoms. And like we talked about, addressing oxidative stress and inflammation, because they go hand in hand. And we look at getting a powerful antioxidant like alpha lipoic acid mixed with B12, B6, and B9, because we know that B12 deficiency is one of the most common causes of diabetic and non-diabetic neuropathy. So again, medication management, medications are used, like we said, to treat chronic neuropathic pain, and they're antidepressants, anticonvulsants, and such as gabapentin, pregabalin, Cymbalta, and these medications are also useful in treating other conditions, but mainly treated for neuropathy, and they do come with a lot of side effects or complications. So be aware of that, that the higher the doses we take, the more complications or side effects that can occur. Yes, they are useful, but there are other options, especially when it comes time to supplementation, to say that we can sometimes address neuropathy symptoms with supplementation to avoid some of the complications or side effects. And a lot of people who are suffering from neuropathy also have other medications that they're taking. So we always have to be aware of what other medications they're taking to make sure they're not contraindicated or basically have negative interactions with each other when they're taken together. So again, some of the side effects of taking medications that are prescription are dizziness, drowsiness, weakness, unfriendliness, usually, forgetfulness. It can have negative impacts on the GI system as well. It can also have on the nervous system. It can have loss of concentration, blurred vision. It can also have some negative effects and increase sometimes some swelling in the hands and feet. So these are some things that we should be aware of when we're looking at side effects of medications, even though they're beneficial. But if we can somehow take or lessen the dose that we're taking to alleviate some of these side effects and combine it with supplementation, that's going to be very helpful in the long term, getting people back to their activity of daily living, because of the fact they don't have to worry about some of the complications or side effects that go along with diabetic or non-diabetic neuropathy medication treatment. And this is really where we focus our treatments on in our practice here, is on supplementation, because of the fact that we understand the etiology of diabetic and non-diabetic neuropathy, like we talked about, is really oxidative stress and inflammation. And there's a lot of supplementations out there that we can look at that can address oxidative stress and inflammation, and also address some of the things that are lower in the body, such as B12 and B12 deficiency. There's a study out there that showed that the intake of metformin, yes, it's great to control diabetes, but it can affect how B12 is absorbed in the body. We call that B12 malabsorption. And if you don't absorb enough B12 in the body, that puts you at a higher risk of developing neuropathy. So understanding the role B12 plays in addressing diabetic neuropathy, and understand that, yes, B12 is important in the body, but you also need supporting ingredients such as B6 and B9 in the body to have B12 function optimally. So if you have adequate levels of B12, but B6 and B9 is low in the body, or you're not getting enough of B6 and B9 in any supplementation you're taking with B12, B12 is not going to function optimally in the body. And then also with alpha lipoic acid, which is a great antioxidant to help control, oxidative stress and inflammation in the body. And we also talk about omega-3s and vitamin D and their role in helping not only control neuropathy symptoms, but also helping, when we focus on type 2 diabetic neuropathy, it's helping blood sugar metabolism in the body. And we know that with supplementation, our goal is, number one, to reduce oxidative stress, repair damaged nerves, repair damaged circulation, and also lower inflammation in the body. We know that lower homocysteine levels, lower sorbitol, and increased nitric oxide levels have been shown to be very beneficial over time in not only helping focusing on type 2 diabetics, but lowering inflammation in the body to a point where we can have a positive impact on supplementation. So focusing on B12, we call it L-methylcobalamin. This is essential for proper nervous system function and repair. This creates energy from carbohydrates, proteins, and fats, and the most active form B12 in the body. We call that bioavailable, meaning that L-methylcobalamin is ingested, so it's readily available in the body, where other types of B12 are not bioavailable. So looking at the ingredients, and if you are looking at B12 supplementation, you want something that's bioavailable, such as L-methylcobalamin, which is the most bioavailable form of B12 in the body. It aids in binding nerve conductions for mood, memory, and brain function, also assists in nerve repair. We talk about regenerating axonal communication, and that's really where B12 plays a great role in helping support diabetic and non-diabetic neuropathy. And then B9 is basically methyl hydrofolate. Folate is the inactive ingredient, and 5-methyltetrahydrofolate is the active or bioavailable form. So, looking at how are you going to address B9? So if you're looking at taking B9 as a folate or a folic acid, that's really inactive form. You really want to focus on taking the active form or bioavailable form. We know that's crucial for proper brain functioning and works hand in hand, like we talked about earlier, with B12 to make red blood cells utilize iron more efficiently. It also is, the proper amount of folate in the blood is essential for the function of B12, like we talked about. So if you're having an adequate level of B12, your B9 level is low, B12 cannot be utilized efficiently in the body, resulting in what we call de facto B12 deficiency. Even though your B12 level is normal, you're going to have an inability to use B12 efficiently in the body if your B9 level is not efficient. So folate deficiency can contribute to nerve damage, as we know, and numbness in the limbs, also known as peripheral neuropathy. So understanding the roles that B12, B9, and also, B6 play in the body. This is something to support the role of folate. One study, they had patients with severe neurological disease that was clinically indistinguishable from subacute combined degenerative spinal cord. They were all given check B12 levels, and all were deficient in folate. And these findings indicate the need to review the concept of looking how folic acid interacts with B12 to support a healthy nervous system. And that's really important to understand, like we talked about how B9 and B12 work hand in hand together to support an efficient system in the body where we can support nerve health. And then B6 is pyridoxal 5-phosphate, again, the active ingredient. And we understand that there's a variety of functions that B6 plays, but also it's crucial in gene expression, also assists in blood sugar metabolism. But also, again, if your B6 level is low and looking at how it supports B12, it's really not going to have B12 work optimally in the body if your B6 level alone is low. So having adequate levels of B6, B9, and B12 in the body are really important when we talk about supporting nerve health and supporting diabetic and non-diabetic neuropathy. And then alpha lipoic acid and chromium. These are great antioxidants. They protect against cell damage. They enhance the effects of other antioxidants in the body. Not only do they help in glucose repair, but alpha lipoic acid also is important when we talk about, nerve health and lowering oxidative stress and inflammation in the body. Then omega-3 fatty acids, those are important for reducing inflammation. We talk about affecting circulation and how that microcirculation can affect the nerve endings. So omega-3s help reduce triglycerides, improve circulation, and they support healthy blood sugar. Again, that also helps supply blood to the nerve endings, transport, so those nerves can get adequate nutrition they need to function. And also omega-3s have been shown to help support blood sugar metabolism, especially in people who are type 2 diabetics suffering from neuropathy. And then vitamin D3, we understand that 9% of diabetics are deficient in vitamin D. I'd probably say that 9% of the population is deficient in vitamin D because of the fact that we don't get outside as much as we used to. We don't exercise as much, especially in the winter months as well. So this deficiency can lead to poor insulin sensitivity and poor blood sugar control. And we know that benefits of additional vitamin D3, usually 5,000 international units a day is what's recommended. Improve insulin sensitivity, help with osteoporosis, also helps reduce inflammation as well. So you can see that omega-3s and vitamin D are crucial, along with alpha lipoic acid and the antioxidants, to lower inflammation in the body, improve oxidative stress, along with B6, B9, B12, all help with nerve regeneration and repair some of the damage that has occurred from diabetic or non-diabetic neuropathy, whether it's from diabetes or toxin ingestion or chemotherapy. All these supplements actually help treat or alleviate some of the neuropathy symptoms that can occur. And again, the B6, B9, 12 combination helps with diabetic and non-diabetic peripheral neuropathy. There's a lot of information out there looking at this combination in treating neuropathy. There's been studies published by National Institute of Health looking at B6, B9, and B12, and they've been shown to reverse both the symptoms and the damage of diabetic peripheral neuropathy. They found within 1 year of treatment that B vitamin therapy appeared to promote restoration and loss of sensation in skin and increase the density of certain nerve fibers in the extremities. So that kind of supports that role we were talking about, regenerating axonal regeneration. And also there was some articles written by Dr. Alan Jacobs supporting alpha lipoic acid and looking at how metformin can actually worsen diabetic peripheral neuropathy because of how it affects B12 and alpha lipoic acid and the absorption in the body. So replacing that with additional supplementation has really been positive and reversing the effects of diabetic neuropathy. So again, this is some of the supplements that we offer here in our practice. We do offer supplements, including B6, B9, 12, and alpha lipoic acid. These are some of the EBN supplements, M5 and N3. And, we talked about metformin related B12 deficiency, even though metformin is a necessity that we recommend people use to treat blood sugar elevation, but understand that there are side effects with any type of medication. One of the side effects of metformin is B12 deficiency. So that's kind of what we're going to end off with. And I'm going to kind of open it up to everybody else if they have any questions about, diabetes related neuropathy or non-diabetic neuropathy, or any questions we have about how we treat neuropathy in our practice. I'm going to unshare my screen here for a second. So number one, I want to thank everybody for taking their lunch hour today to spend time with us to learn about diabetic and non-diabetic neuropathy and our treatments. And, if you are suffering from neuropathy symptoms, I welcome you guys to make an appointment in our practice to get evaluated and learn more about our treatment options for diabetic and non-diabetic neuropathy. Supplementation plays a big role in how we handle neuropathy. We also offer different modalities for assisting in alleviating neuropathy pain, whether it's through cold laser therapy. We also offer a treatment called Cadenza, which is a specific treatment specifically for type 2 diabetic neuropathy, where we use 8% capsaicin for a 30-minute treatment here in the office every 3 months. That's been shown to be very successful also in alleviating neuropathy pain and concurrent with the other treatment options we talked about, whether it's supplementation or medicinal management with whether it's gabapentin, pregabalin, or Cymbalta. So there are many options available for neuropathy, and our practice offers many of the newer treatments out there on the cutting edge for treating neuropathy. We are very successful in treating neuropathy. We're one of the few practices in Pennsylvania who kind of focus on diabetic and non-diabetic neuropathy management here. All right, well, I want to thank everybody again for getting on the call, and I hope everyone has a great day.